the question about treatment in terms of medical treatment of prisoners suggests that prison is not a microcosm of the society in which it resides. Medical care is a catastrophe for people who are allegedly free. And that's because medicine has been made a business, right? And it's become mercantile.
This is a call from Pennsylvania State Correctional Institution, Mahanoy. This call is subject to recording and monitoring.
As a consequence, most people in this country, especially working people, middle-class people, cannot afford medicine. Price has really gone beyond their ability to pay for it. The same can be said for prisons, except most people in prison, being poor people, they have to worry about a $10 or $5 or $15 fee to access medical care, where medical staff don't care whether someone gets treated or not. And that's it. I mean, the difference here in prison is that someone can have a condition and they file a sick call slip. It literally may take them years until they get treatment. And even if they do get that treatment, that's at the discretion of the prison system, not a medical unit or hospital, because the needs of the prison system supersede the needs of a patient and the requirements of a medical provider. And they may be mistreated. There are many legendary cases of people being treated very badly in a prison setting. And that's for most prisons. I'm not talking here about political prisoners because, people are treated generally the same, which is really, really quite poor. There are people in prisons who make a pretty good piece of money because they're private corporations who get state funding to care for people. And in turn, because those people are prisoners, the medical providers generally don't care. So people get, forgotten, mistreated, and, left to fend for themselves in a place where, pandemics can rage as it did during COVID. There was one prison in Pennsylvania where...
This is a call from Pennsylvania State Correctional Institution, Mahanoy. This call is subject to recording and monitoring.
That was Dallas Prison, where you really had it out of control. And guess what? COVID is back. It's at a lower scale. But I was talking just a few days ago to Johanna and telling her about a Puerto Rican Muslim brother who complained about being treated for another ailment. Well, him and his cellie, or his cellmate, caught COVID. The Puerto Rican went to medical. The other guy didn't feel like going to medical, and in 2 days, he was literally gone, dead of COVID. So, anything can happen, and it's the nature of just capitalism, consuming lives for the sake of money, not treating people because of their medical needs. That's just the way of it. I hope I've answered your question. Thank you for asking.